everyone. I am so excited today. And so just as you're coming in, if you're here for caregiver education, the path to solving the caregiver shortage and improving outcomes, you're in the right place. And we'll get started very soon, very shortly. Thank you so much for spending some of your Thursday with us, and look to provide some very interesting insights.
Good afternoon. I'm so glad that you've joined us today. I'm so excited about this webinar. I've been looking forward to it all month long. Caregiver education, the path to solving the caregiver shortage and improving outcomes. We all need to hear this, and I'm so excited for Helen to be joining us today. She is an incredible example of a woman who can really take a thought and make it what it is today. She is the CEO and founder of CareAcademy. If you have had no experience with CareAcademy, I hope you'll reach out to them today, because they are definitely an inspiring group. I want to tell you a little bit about Helen. She gave me her bio. There it is. Helen Adiose has had a career in driving outcomes for adult learners and finding meaningful ways for them to engage in learning. CareAcademy was born out of her own firsthand knowledge and experience as a caregiver, uniting her education and passion with desire to better serve the elder community. She has worked with Tech for America, Boston Public Schools, and Pearson Education, as well as a number of companies focused on caregiving issues. Helen holds a BA from the University of Notre Dame in Politics and Arabic Studies, and an EDM in Education Policy and Management from the Harvard University. We're so thrilled for you to be here today, Helen. I'll let you take it away from here.
Cheryl, thank you so much, and wonderful pronunciation also the last name, so kudos on that, really appreciate it. Well, thank you so much everyone for joining us today. We're really excited to talk about an often mentioned topic within our industry. Cheryl and I were just having a discussion about that we talk a lot about what does caregiver recruitment and retention look like, especially when we're talking about the age of COVID and what's happening sort of within the pandemic. And we've been thinking and talking a lot about that. And so part of what I'll be doing today is modifying a little bit of what I'm saying about how folks should be thinking about opportunities and challenges and opportunities within the COVID environment they're currently in order to recruit, onboard, and really retain direct care workers. Some of this is in our new normal. There are a new normal set of best practices. We're still distilling that in real time and want to be able to provide that. So Cheryl, thank you so much for a wonderful introduction, and I'm really excited to talk about the topic today. So if we can go to the next slide. So our learning objectives. So I, just so you all know, by way of background, I've been a direct care worker. I've also been an educator. So I always kind of frame with my teacher voice and think like a teacher. So thought that we should have some learning objectives for today. Our objectives are learn how to use education to really build a pipeline of talent. For us, education is not a nice to have. When we talk about education, it's actually part of your recruitment efforts, right? Improving that you're invested in providing the very best for candidates as future employees. So talking a little bit about that, how you tactically implement upskilling and career ladders to increase caregiver retention. Cheryl had this wonderful word when she talked about CareAcademy, and I believe also this for every single direct care worker, the idea of aspiration, right? And so how do you build aspiration within your community of caregivers and really within your employee base? Understand current academic research, which shows how the knowledge of caregivers impacts clients living with Alzheimer's disease and those going through heart failure. I think these are very interesting times to be talking about the health outcomes and opportunities also around direct care workers. Coming out of COVID, I certainly see that in the future, we'll be talking a lot more about the outcomes and the data that supports direct care workers. And so this is some of the initial data that we're seeing pre-pandemic, but very, possibly 2018, 2019 data released about the impact of direct care workers. So we're going to talk about that and understand tactics for successful implementation of caregiver education as a health intervention, as well as lessons learned from failed implementation. So just sort of how we are distilling best practices, and I'm super excited to talk about this today. Go on to the next slide. So our caregiver shortage, what we're learning right now in terms of the big picture, and I always like to frame with a big picture, 54% of caregiver employment growth by 2026. That means that we are going to see, in the terms of openings of caregivers needed in the US, that is set to grow by 54%. I'm curious about what that looks like in a post-pandemic world, but that is what we were slating for pre-pandemic. And then 7.8 million direct care openings from 2016 to 2026. So employment growth as well as opportunities and actual number of openings, right? 7.8 million direct care workers. Right now, we are severely under that in terms of the number of direct care workers that are available in the US and really globally. And so it means that our frameworks have to change to be able to bring folks into the space. One of the initiatives that we're running right now is to help bring folks into the space here at CareAcademy around the future of work and positing direct care work, home care work as the work of the future. And so we've got to really sort of expand our thinking about ways of bringing direct care workers into the pipeline. Next slide. So turnover, median turnover as of 2020, according to Home Care Pulse, is 64.3%. It's worthwhile noting that this has gone down significantly from the years previous to 2019 when this measurement was taken. But we're seeing turnover still remain relatively high compared to other fields, including healthcare, right? And so regardless of how this number fluctuates, we know that in order to not only attract people into this field, we've got to keep them here in order to have significant positive outcomes, given the rise of the baby boomer population and the aging population of our country. Next slide. So how does training really play a role in caregiver recruitment, onboarding, and retention? So this is what I want to posit in terms of thinking bigger than compliance. A lot of you all, if we took a poll right now of, how we by and large see training, especially within healthcare or home care, it is really framed around this idea of checking the box. And so, at CareAcademy, really think more expansively about how do we use education to actually create efficiencies within the business of home care. And that's what we're really centered on, insofar as providing education. So we'll talk about that. Next slide. So the top 5 reasons that caregivers choose to work for a provider are, it's the first job they applied for, right? It's a very pragmatic answer. It's a good working environment with benefits. Company was recommended to them. The company has a good reputation, and working schedule met their lifestyle. So these reasonings, right, are actually, if we thought back to our own first jobs or our own career, it is knowing that one, that the opportunity and the job met my lifestyle and had a level of flexibility, which we can agree that home care can provide a level of flexibility, but then also that there was a good working environment. Either the company was recommended, or that there are benefits that are being provided, or had a good reputation, right? And so I wanted you to put this in 2 different camps. One, that there was a level of flexibility offered by the provider. The provider moved fast, there was efficiency, and also that the company came highly recommended. And just hold those 2 in your mind for a minute in terms of why a caregiver chose to work. And so education, I think, can fit into having and holding all of these 5 things to be true for any home care agency. Next slide. So the reasons that caregivers leave an agency include poor communication, hours and scheduling. So again, efficiency, flexibility in scheduling, pay and benefits, little or no training, and lack of recognition, right? So if we hold both of these 2 things together, the slide previous and this one, it's really about how effective and efficient are your systems. And 2, are you a company building a reputation around quality and the ability to meet the needs of employees, right? And just so holding those things, this is the other side of the coin to why caregivers come to work for an agency, is also the reasons that they are leaving agencies as well. Next slide. So, in terms of that first rank, the first job applied for, caregivers are often working for multiple employers. And while you can't control, where someone applies and sort of the motion of that, you can't control how fast you hire someone. For us, we advocate for thinking about that very first introduction to your agency, the way in which you present the opportunity of caregiving, especially in pandemic times. We have just an excitement around the opportunity to bring in new folks because of the relatively high unemployment that we have, within the service industry, right? And the same rules apply, and I think they even apply even more, because you have folks who have the instincts of service, who may be interested in home care, but at the same time need some level of introduction into what home care is, whether that's shadowing, mentoring, and certainly education. So you have to have efficient processes in place for job posts, screenings, interviewing, background checks, and orientation. Each step is an opportunity for someone to drop off, especially now that I know a lot of you may be doing hiring over things like Zoom. How do you reframe your hiring processes to make sure that the places that you need touch, you have touch, but you also have some level of efficiency? And I would imagine a lot of the process is changing for a lot of folks right now, but how are you rethinking that? One of the most pragmatic things that I urge folks to do on the call, because I like the tactical, right? I also run a business. I live in the tactical as well as the strategic. One of the things that I want you to do today is to, spend 30 minutes going through, if you haven't been through it yet, your own application process, your own sort of onboarding processes. And in the last 3 or 6 months, we've seen technology providers, including ourselves, add in new features in ways to make things and adjust to the world as it is right now in this pandemic. Make sure that you're really utilizing, you're probably paying for some of these technologies and application systems. Make sure that you're really utilizing to the full benefit that you can, how to turn on features or turn on features that may be benefiting you in the course of bringing folks in the motion of your recruitment processes. Do me that small favor today and take 30 minutes and come in or look at your application process as a direct care worker, as a caregiver, and see what are the ways that you can optimize your system, right? Because I really believe in, that 20% for the 80%. But that is one of the first ways in which we can revise how we're doing things to make it much more efficient. If the first reason that someone works for a home care agency is really based on that's the first job they applied for it and possibly heard from someone at your agency on your back office, then it's worth looking at those systems and making sure that we're reaching out to folks as soon as possible. Next slide. So recruiting processes, your screening processes. So we can reduce pre-employment churn with training. A lot of why caregivers, especially newly arrived caregivers, have some reticence around providing work is that they don't know what that looks like, right? And so we've got to optimize training as not only a form of screening, but as a way of pre-educating caregivers before they come in and they, or they go out into the field. So an introductory training course on what it means to be a caregiver is telling folks, it's telling you if they haven't started the training, they're unlikely to show up. If they started and didn't finish, they could have realized that being a caregiver is not for them. So even the motion of providing some level of awareness around what caregiving work looks like is a way to rapidly tell if this is someone that is engaged, right? It's also a way, especially if you're providing online training, for you to be able to see where's a point of drop-off and a place that you can provide supports, right? Typically seeing drop-off in a class, in my educator as well as my employment mindset is that is when I pick up the phone and I ask if there are any questions that someone has, right? So you're scaling your process of bringing in folks by way of providing some level of education, and then you're utilizing your ability to see where people are in the process to reach out to them and say, do you have any questions? Are there things that are confusing? So if they've completed the training, they have a higher likelihood of continuing the interview process, and you know that they have a set of expectations for what the role will entail. What I suggest, especially since we're not getting as much eyes-on and hands-on with direct care workers as part of the screening process, is utilize the points in your education and your screening just to reach out to folks too, because I think that makes all the difference, knowing that there's someone on the other end of this sort of screening process as well. Within the campaign that we're running right now, I make a point actually to call folks who are interested in home care, who are taking part in the training process, just to see where they're at and understand what are their motivations. And I really highly suggest that as part of your screening process, you're adding a level of touch as you're seeing the insights of folks completing training. I think that's the beauty of thinking about this from a high-tech perspective as well as a high-touch perspective. Next slide. Next slide. Thanks so much. So in terms of, we go back one. There we go. So interviewing, are you asking the right questions? Are you looking for skill? Are you looking for aptitude? What are their goals? I think what we're always trying to determine, and keep in mind, all of the parts that we're talking about, these are happening in a number of days, right? This is not over weeks, this is as soon as possible. As you're interviewing folks for fit, and even if they desire to work within the field, it's asking for a level of, skill as well as aptitude. I think sometimes coming from the healthcare world, we tend to want to acknowledge the skill of caregiving. I would actually turn that on its head, right? I think in this moment, if we're really trying to find people, and we call this oftentimes, I don't know if you all call this, but I certainly call this too, folks who have a heart for caregiving. What we're really testing here is sort of aptitude, right? Is this something that you're excited about? Is caregiving something you're excited about? Do you have a heart for service, right? And then if you have that, I can teach you the skills. Skills come much easier for someone who's willing, right? So an example of an aptitude question may be, tell me about a time when you encountered a problem you had to deal with while working independently. And that is an aptitude question that really gets at, a level of critical thinking. Is this someone who has a mindset of, what do I need to do to be able to empower my clients? And so that's a really great way to kind of think about aptitude. So for homemakers who may be new to the industry but have the qualities of a great caregiver, you'll need to focus on aptitude. They can always receive training on the skills portion. With the current shortage, we need to be hiring out of a larger pool. This is certainly a moment that we're finding people are very interested, either because they provided or are providing caregiving services for a loved one. They come from the service world, which is seeing a huge hit because of the pandemic, have a heart for service and are customer service oriented. And so teaching them the skills and finding ways to teach them the skills, something that you can totally do within education. So this process also helps you identify skills gaps and potentially develop a learning plan. So those are just some of the key points there. Next slide. So the recruiting system, building a pipeline of talent. Before we started the webinar, Cheryl and I were kind of talking about, what I call the sins of home care, right? And I actually think that this set of suggestions, are things that folks are, most of you all are already implementing some, or if not all of them, but thinking about ways that we can kind of take this up a notch. One, always be prepared to hire, right? Even in the midst of the pandemic. That'd be my next little thing if I just sort of change around. There we go. Always being prepared to hire, especially in the midst of the moment that we're in. And I think there's certainly those opportunities. If we're letting folks know that we are willing to reskill them and retrain them in order to bring them on board. Building a referral program. We've certainly seen an uptick in the number of community-based services and hospital systems who are looking for and are trying to find great providers within the community, especially just given the focus on home services and home care. So word of mouth is one of the best sources of caregiver referrals. And so even connecting with businesses that are transitioning in this moment and want to provide options for employees, connecting with those business owners is something that we've seen folks utilize more recently. So asking the right interview questions, looking for both skill and aptitude, and create more touch points. You have opportunities within your application process just to reach out, because you'd be surprised how few people are just reaching out over the phone and seeing how folks are doing, and if they can be of any service by phone, email, Zoom, and especially text messages. And make your job postings really caregiver centric. A lot of the time it's the simple stuff. I spent a little bit of time reading through a very popular job postings board for caregivers, and I'm surprised by how few folks and agencies are talking about ways in which they are reskilling and things that I think we're taking for granted, that we're providing things like, PPE, right, in this moment and in this time, but ways in which, and assurances that if someone works for you, that you can keep them safe, and you're thinking about also their safety. So it's the simple stuff, especially in this time, ways that you can provide to skill and retrain folks, right? And so think about it from the caregiver's perspective. Stage 2, hire a scheduler or care coordinator. When folks even start agencies, I suggest having this type of role, even on a part-time or contractual basis, just to help get the motion going and help you process through finding good caregivers even faster. Collect and use your data. If you take my suggestion, your homework, right? I'm a teacher, so your homework is to spend 30 minutes in your applicant tracking system and the systems that you've set up to bring in caregivers and the motion of that. Spend some time also figuring out where in the back end of your systems, what is the data telling you? Put some time off on your calendar to really explore that, right? Where your highest concentration of clients are and focusing on recruiting efforts there, where the highest concentration of caregivers are coming from. What are the sources of caregivers as applicants within your system? Dig into your data a little bit and use that to set forth the strategy. We're in strategy planning mode at CareAcademy and using some of that data to plan your recruitment efforts, and building out really your caregiving staff from that is going to be really helpful. And stage 3, create partnerships with community colleges, vocational schools, and online training schools. So utilizing and reaching out, we've certainly seen a number of employers say, hey, CareAcademy, we heard that you're doing this sort of future of work thing. How do we get involved with that, right? And so thinking very opportunistically, working with other employers who maybe want to provide some opportunities for their employees is certainly something that we've seen as well. So creating that pipeline is turning up a notch, maybe some of the things that you're already doing. Next slide. So onboarding. So now that you've got, caregivers coming through the door and you're working through opportunities to recruit, onboarding is also this other place that we see the pinch of folks who may leave or drop out of systems, right? And so onboarding is something that even within CareAcademy, we've paid attention to how we bring on folks as we're hiring them right now in this moment. And I think no matter your business, no matter what you do, onboarding is something we have to pay attention to, especially given that we're not able to do as much of the hands-on, or folks are not doing as much of the hands-on as possible. That 30, 60, 90 day time period is something to pay attention to. And according to Home Care Pulse, the cost of turnover of a single caregiver is $2,600. That $2,600 can be used to invest in your caregivers to ensure they don't turn over. So higher wages, the recognition, referral bonuses, and training are all a part of how you can leverage some or all of these in order to really make sure that caregivers are also seeing the onboarding process over time as aspirational. I talk with a number of our customers, and some of the best practices that I'm hearing are, there's a lot of peer mentorship happening right now. And so how do you leverage someone who's a veteran within your agency to also provide a level of hands-on in a very, figurative sense, while caregivers are really going through the process of onboarding, having regular check-ins, just as you're motivating folks to go through your applicant system, you're utilizing some of those simple tools of just reaching out in order to get folks to fully onboard. One of the things, simple tactical stuff, I love that stuff, right? One of the things I really encourage, and we've actually done something like this within CareAcademy, is making the onboarding process really a process that you lay out, right? What does it mean to onboard within your company? Just like there's steps in your application system, what does it look like to onboard? What does the checklist look like to onboard for a caregiver? Laying that out and providing that level of simplicity of these are the steps that you'll take, in order to work with the client or after your first client. Laying that out also really helps in terms of making it very clear, how do I get to work, especially as you're having applicants in this time who may be very new to providing care, providing home care. Next slide, rather. So engaging with caregivers during onboarding, making sure caregivers need to be recognized. Tactically, what we've seen this look like is as caregivers are completing each step and getting closer and really closer to you know, being fully onboarded. It's providing motivations or recognitions. That might be a company-wide email recognizing caregivers for having gone through, you know, a certain step. That might be, you know, a gift, right? Or a piece of swag, or a piece of a t-shirt or something that recognizes folks for becoming part of the family or becoming part of your agency. Have caregivers meet the team. A sort of a COVID opportunity that we've seen is having caregivers talk a little bit about themselves, whether it's a chance to highlight them over a Zoom call or a check-in across the company, or a little bit of a profile as well. Providing support, call before the shift, call after the shift, and after the first week. A successful CareAcademy client makes sure to talk with all new caregivers for 5 minutes a day. One of our customers that we typically highlight talks about how critical within his agency it is to check in very often and provide mentorship. Are there other more experienced caregivers that you can pair with the new hire? So that's the mentorship that we're talking about. I feel like in this moment where you can't directly see or have as much contact, it's even more critical to have folks who are reaching out. I've seen everything from home care agencies to churches utilize this idea of reaching out and a call tree, right? Whether it's your staff or other caregivers who are reaching out to new employees. Next slide. Next slide. Oh dear. All right, let's see. I will, a little bit of that, no worries. So I will share my screen. All right. All right, present and, okay. Let's see if we can. Okay, let's see. And if Cheryl, can you share your screen on the deck there? Do you have access to that?
Yes, I will get it. Just give me a moment.
Oh, no problem. Thanks so much, guys. New normal, all technical issues on Zoom. So I appreciate your patience. Thank you so much.
Actually have option as coach if they are generating enough to be across.
Oh, I think we hear someone's audio as well too. Oh, there we go. Great, awesome, great. Thank you so much for that. And so training during onboarding, making sure that caregivers need to be trained and prepared. It reduces stress and burnout. Again, because it's making folks feel secure. And so providing, again, some level of knowledge preparation of what happens when you actually meet a client. And so we recommend in this time, and we've seen folks do it in the midst of the pandemic, utilizing Zoom as a means of doing role play, right? And so role playing, doing some level of education also asynchronously or on their own is a very helpful means of really training during onboarding. Helps folks understand the care plan. We'll talk about this in a second, but we've certainly seen that is a really great opportunity to really impact health outcomes, helping caregivers understand what a care plan is and its importance. What are some of the disease states that are mentioned in the care plan? and shows that you're investing in them and their professional development. And then also shows that your referral sources, that you have a systematic approach to producing all types of good outcomes with clients, especially certifications. We'll talk about that in a moment, but the opportunity here is to skill and upskill and think about ways in which you provide that skilling dependent on the needs of your clients. So we'll talk about that in a minute. And of course, and the thing that I can't stress enough is that soft skills and hard skills training is absolutely needed. So making sure that you're able to provide those skills as well. So I really recommend the role playing as a way to reinforce those, and also making sure that in your education you stress the importance of the soft skills and that interpersonal skills, the professional skills, and those service skills as well. Next slide. So a sample caregiver onboarding training schedule includes orientation, so the curated training, whether it is policies and procedures that you currently have, the Care 202, which is one of our classes around care clients' rights, and then also, training and procedures training overall. And also some of the basics classes that we recommend is the Introduction to Dementia Care. The 30-day cycle, so as you're getting caregivers to complete over time, you're onboarding, what does it mean to be a professional caregiver? Professionalism, communication, problem solving, and cultural competency. An overview of mobility, safety, and equipment. Safety and falls prevention is huge. And then in 60-day, we talk about safety and falls prevention. You've already provided them that at the very outset, and then doing that on the other side, maintaining a clean and healthy environment, specific training, any sort of specific training that's requested on behalf of the care plan or the family, and then looking at an annual training requirements to and then going back to those policies and procedures. So this is a sample caregiver onboarding training schedule of one of our customers, and it really proves out to be sort of over time you're utilizing that 30 and 60 and 90 days to provide that training. Let me see if. All right. Okay. Let us see. I think let's. Awesome. Let's see. Hey, Cheryl. Let me see if Cheryl, if you can unmute for 1 second. I think we.
Yep,
we
I
lost.
gotcha.
Yeah. Yeah.
I gotcha.
Oh, thank you so much.
I'm trying to.
Yeah, if you share screen and then perfect.
I'm not sure how to get it full screen though.
Oh, yep. If you go up to present on the top right-hand corner.
Top right-hand corner.
Just click that button right there, present. There you go. And you just click that. There we go. Perfect. Thank you so much. Awesome. So this is perfect. This is great. Thank you so much, Cheryl. So this is a sample caregiver onboarding training schedule. If we go on to the next slide, Cheryl, if you don't mind. So this is actually what we call our recruiting, onboarding, and retention process or wheel. What we feature here is that you can utilize education at every single aspect of your processes, right? Whether in the recruitment process is looking at skills gaps, career pathing, the analysis of sort of what the client needs, staffing support for new caregivers, but there's a whole host of opportunities and places that you can really utilize education. Onboarding, whether for a caregiver to meet the needs of all clients and attract referral partners, or retention, using it as a way to meet the needs of veteran caregivers. So providing credentials. Earlier, I talked about certificates as a way to upskill. What I mean by that is, for instance, at CareAcademy, we have credentialing around COVID. That COVID certification was really meant as a way to gain the trust of clients and their families, and also show and demonstrate that caregivers were taking the necessary steps, and agencies were taking the necessary steps to prepare their direct care workers. So I find that that is absolutely, necessary as a way to show that, once you've been a caregiver with your agency for a couple of years, doesn't mean you know it all, but you're building on requisite skills over time. Next slide. And so attracting and recruiting talent through training, so that pre-employment training is key, identifying those skills gaps, career pathing for caregivers from the start, and freeing up time that you would have spent sort of doing the back and forth communications to arrange multiple in-person trainings, to spend on recruitment. So meaning that you're providing training, you're providing information about your agency as a way to really reduce the amount of time that we're spending in that communication state with caregivers. Next slide. So effectively onboard caregivers through training. That means quickly meeting state compliance mandates, satisfying the needs of sort of high profile clients or high needs clients, onboard faster with the critical 90-day period, and provide support through preparedness. Onboarding and using training throughout the process of onboarding, just to even just reiterate that in the next slide. Retain caregivers beyond the 90 days through training, retaining veteran caregivers, and building career ladders, as I just mentioned earlier, through upskilling pathways and certifications. And next slide. So those upskilling pathways, one of the ways we talk about career pathing, especially within very large organizations that are looking to motivate caregivers as they're coming in, especially now, over time, is that within your agency, if you're scaled out, you have if you provide education and training, you can actually provide a way for caregivers to go from companions, homemakers, the home health aides, and home health aide sort of mentors or supervisors. These are the most common pathways that people are creating within agencies to say, hey, look, this is sort of the hierarchy. This is where you can go and build your career within our agency. Next slide. And then the certifications that I mentioned earlier, the certifications are a way of providing sort of upskilling pathways, whether it's Alzheimer's and other dementias, hospice and end of life, nutrition and diabetes care, heart conditions, scheduling, and caregiver coaching. These are little certifications. These are sort of micro certifications that you can provide caregivers as a way to upskill them, right? So upskilling and providing education doesn't have to be this sort of big thing. It actually works and is aligned with the goals of your agency, right? And making sure that caregivers are prepared to meet the needs of clients. And this is a really great way to engage folks and say, you've started out with us, you've onboarded, but over time, we'd like to provide you ways of upskilling and learning these new skills that are critical. Here's how we can make sure that you're aligned to the needs of clients, right? By providing these certifications and providing incentives that are also aligned with these certifications. Next slide. So a case that I wanted to talk about, very early on, I mentioned improving client outcomes with sort of two cases. So Alzheimer's disease and heart failure. With Alzheimer's disease and heart failure, these are two studies that have been done that talk about the impact of caregivers. One's more of a survey and the other one is a qualitative study, but we can talk about that next. Next slide. So teaching Alzheimer's care to caregivers. So Allison Cook is a researcher with PHI, Paraprofessional Health Institute. They are a friend of CareAcademy and certainly a leader of policy studies and outcome studies within home care. So the number of people age 65 and older that have Alzheimer's disease or dementia will rise from 5.3 million to more than 7.1 million over the next decade. Research points to interventions typically provided by caregivers like music therapy and art therapy as a means to reduce the need for medications for older adults with dementia. This study was really interesting in that what they found out at PHI is that caregivers were developing the tool set to be able to find ways to reduce aggression among their clients, including things like music and art therapy. So caregiver education and learning about those tools, learning about the best research to avoid medication can actually help clients keep medical and pharmacological intervention at a minimum. That's what we're finding out in terms of the opportunities to really expand the tool sets of caregivers. So that being said, next slide, Cheryl. Thank you. Caregivers must have the knowledge of disease and conditions with which their clients are living with. Caregivers need to be emotionally and professionally prepared for the idea that their client may undergo changes in personality and physicality. And proper training and preparation include ongoing education and support on a wide range of competencies, such as the basic science of dementia, the stages of dementia, and what to expect during the progression of the disease, and ways to communicate successfully. So those are the things that we're noting in terms of how teaching Alzheimer's care to caregivers can really have an impact. Next slide. So caregiver capacity for working with clients with heart failure. So this is a qualitative study performed by a cardiologist who's doing research on behalf of the American Heart Association. And in it, Dr. Sterling just really acknowledged that unlike physicians, home care nurses, home care workers, and HHAs are with patients on a daily basis. So when a caregiver travels to the hospital with the client in emergency situations, they don't often have a basis of really communicating with clinicians about what's happening, right? If that were to occur, they don't have the basis of doing so. So in the study, caregivers were called being just really frustrated by care plans of their clients, providing little to no information on the symptoms of worsening heart failure. One of the things that I noted and I empathize with as a caregiver is feeling like a lot of the knowledge that I was given was sort of ad hoc. I was finding it out as I was needing to, as opposed to feeling prepared. One of the attributes of burnout that we know of is just this feeling of lack of preparation in terms of meeting the needs of patients and clients. And so how can we think of ways of, if we know the care plan of the individual and the disease states of the individual, how do you educate right now on Alzheimer's, on dementia, on heart disease and heart failure, right? In order to ensure that we're helping caregivers really meet the needs of clients and patients. So if you go to the next slide, please. So in the example of heart failure, caregivers need to be provided education on very specific health issues. So at least giving folks an introduction into what the disease is and how to support really healthy options. One of the examples, an example of what a caregiver was doing correctly is she was feeding a high salt, high sodium diet to her patients with CHF. And that's an absolute no-no, right? But there was never really any context given around the care plan of the individual. So furthermore, in the case of education as a health intervention, providing caregivers the vocabulary and the means to communicate with family members and clinicians, because their power to monitor the day-to-day progression of their client is key. So one of the quotes that I was left with in terms of thinking about ways in which we support direct care providers we're with the clients all day. This is what a caregiver said, more than anyone else. So why aren't we included in the conversation? That's what a caregiver mentioned in the study. And I would imagine that a lot of caregivers feel that way, especially in this time. Imagine caregivers saying that about COVID, right? We're all learning about what this disease meant, and they were on the front line. So how do we provide caregivers with tools and the means to understand what diseases are, and also how they play a part in keeping their clients safe and themselves safe as well? Next slide. So in terms of translating healthcare upskilling to caregiving skills, so teaching caregivers about the science and the diseases that most frequently impact the client population, making that part of your onboarding or part of your design of your curriculum within your agency. Provide caregivers with the means to communicate with older adults, family members, and clinicians, including the proper terminology. Include caregivers in discussions about care plans. That certainly came up in the qualitative study, and health sort of decision-making processes. So making them a part of what we call at CareAcademy, the Care Circle. Include discussions and role play as a part of your services or training on your services. Empower critical thinking skills within caregivers. What do they do in these critical moments as a way to help them prepare, right, for the complexities of caregiving, and provide progressive education, meaning step-by-step drip education, not all of it all at once, that builds on competencies over time. So caregivers really just feel supported in meeting their clients' needs and their own needs as professionals. Next slide. So with that said, we hope that we've provided ways in which you can take a look at your recruiting, onboarding, and retention methods, especially through the lens of education. And I'm happy to see if we have any questions right now that are coming up.
Well, there was one question that was typed in, and they wanted to know that can your system be used in the virtual classroom training of future certified home health aides? They're in New Jersey and they're required to provide 76 hours of training. So they wanted to know if this would fit.
Yes. So we actually have ways in which this can fit, and we, Obioma, we certainly can get also in touch with you about how this can work within New Jersey's training and licensure system. Does our system integrate with EVV systems? So we actually have an API, and we'd love to know more about that, Kassan. So that's something we can certainly get in touch with you about, just to learn a little bit more about your current EVV system and how that would integrate as a use case. We'd certainly love to hear that. No problem. Thank you. Thank you. Any other questions? All right. Well, if folks have any, I think, will you email us the slides that were discussed today? We can send, definitely, we'll have a recording of the webinar as well as the slides. Absolutely, Dakisha. Thank you so much for asking that. Yes, we will have a recording of our webinar today. Yes, and Laura, I just asked the same question. Absolutely. Cheryl, do you see any other questions coming up? I may have missed it because I think some also come up in the chat as well.
I do not see any questions at this point. A lot of good information, so I'm sure there's some processing going on.
Absolutely. And by all means, I mean, take it slow. I think Cheryl and I talk about sort of the, you get on and it's like, you have all this stuff thrown at you. Take a little bit at a time. I'm certainly guilty of taking everything in and being like, today it all has to change. But if you take away one thing, certainly I'll provide this as homework. Take a look at the things that you're utilizing now, the systems you're utilizing for, right? You're already paying for it, so you might as well take a look at it and see where you can maybe use more of it and optimize it. and certainly, go through with the eyes of a caregiver. I've asked folks in the past, just to kind of secret shop, the application and our education system even. So by all means, take a look at what you're utilizing now. And if you have any more questions, thank you so much, Kasan. I really appreciate that. I think in the next slide, maybe some contact information. Yes, and sorry, the next slide after that. There we go. And so if you have any other questions or you want to provide some sort of input or feedback or suggestions, even on today's presentation, please reach out, give us a call at 1-866-227-3895. And that is also, you can email us at hello@CareAcademy. And Cheryl, do you want to say any last words? I really appreciate just this opportunity to you moderating. You've been tremendous, and certainly before the webinar started, had a wonderful opportunity just to talk with you and find out how even lovelier you are. So any other last thoughts?
Well, thank you, Helen. I cannot express how much I appreciate you doing this and sharing your knowledge with us on what has really become, it's always been an important topic, but even more important topic today. Can you just speak to one more thing? You may have touched on it and I missed it, but one of the things that I've kind of come to the conclusion is that trying to recruit caregivers, you touched when you said you're going to have to go outside of your comfort zone of hiring just people who have traditionally done caregiving and maybe look into other service industries. But do you find that people are going to need a full-time recruiter to be able to keep up with the demands?
I think it depends on how scaled you are and how ready you are. I say that I tend to give advice, and also with the, those little asterisks that you see in the drug commercials, right? And because I think it's also dependent on where you are and what stage you're at. However, I cannot stress enough, in whatever capacity, having someone outside of yourself as the owner or the person who's operating a home care business, who's helping you in terms of the recruitment sync, right? One of the cases that we talked about earlier, even, of trying to first get the client and then get the caregiver, that's not a process that necessarily scales over time. And we find that often, it's the challenge of turning that wheel and getting caregivers in is really difficult, unless you're building that mechanism as it is. And that success begets the other success in a lot of home care businesses, right? Sort of the chicken and the egg proposition of having caregivers in place and making sure they're ready for clients and you're able to staff those hours is often the thing that's going to really move the needle for a lot of home care businesses. And so having someone, even if it's on a part-time, hourly basis, who helps you do that, who is just gung-ho about, maybe another caregiver who is operating in the business with you and is able to go out and recruit other folks, or knows what a good caregiver looks like, can make all the difference for a lot of agencies. When we talk about the founder stories of very successful agencies, and we've had a lot of providers on in the past, that's made the difference, is that right away they had someone who was dropping off applications at the church and helping them screen and do all of those things, because there's so much that it takes to kind of run a home care business. So in whatever capacity that you can, doesn't necessarily have to be full-time, see if you can make that happen and be creative about making that happen for your business.
Okay, there's one last question. Maybe you won't be able to give all the qualities of a good recruiter, but maybe one or two good qualities of a recruiter.
Oh, that's great. I think off the cuff, and thank you, Andrew, for asking that, I think it's someone who just has hustle, right? Hustle and heart. I think even in the early days I believe in being someone who's scrappy. Any business, even including the most famous startups, all had someone at the very outset who was sort of a jack of all trades. So someone who's willing to roll up their sleeves and think creatively about how they fill your pipeline is what you really want. Someone who understands how to talk to people, because and how to communicate, you know, why what they're doing matters, as well as why your agency matters, and can do that with you, is going to be really instrumental. I feel like every single, we did a year ago a founder series with companies who'd scaled out to almost, you know, 500 or beyond caregivers, and then their very early days, they had early employees who were willing to do whatever it takes to meet a quota, right? And so they'd go out, they, you know, leave applications at fast food restaurants. They would, you know, take calls. They would set up text messaging trees, right? But you essentially want someone who is a hustler, and who is maybe potentially another caregiver who knows and wants to really work hard to get the best folks in, and is just thinking very creatively, right? Someone who's very entrepreneurial, I'd say.
Well, thank you. I do appreciate your time. I know it's valuable, and I appreciate everyone who joined us today and stuck it out, and really, I hope you took away some really great nuggets. And I appreciate you as our partners, and I appreciate you, Helen, and all that you do for our industry. And I hope everyone has a wonderful day. That's my last words.
Thank you so much, Cheryl. This is an absolute pleasure. I have a smile on my face because I love doing this stuff. And feel free to reach out, or reach out to us, reach out to our team, and happy to answer any questions. And thank you so much for being with us today. Really appreciate it. Thank you so much, Cheryl.
Thank you.
Take care.
Bye.
Bye-bye.